Let's go ahead and grade our chapter 13. And are we doing odds or evens? Odds. All right, thank you. All right, 1 is true, 3 is true, 5 is true, 7 is false, 9 is false, 1 is false, 3 is true, 5 is true, 7 is true, 9 is false. 1 is C, 3 is A, 5 is I, 7 is B, 9 is H. You should have 2 answers on the word parts. 1 is life, 3 is colon, 5 is instrument used for visual examination, 7 is oxygen, 9 is oxygen. One is cecum, colon, and rectum. 3, expel waste from the body. 5, hemorrhoids, diverticulitis, polyps, colitis, upper gastrointestinal ulcers, and colorectal cancer. 7, early diagnosis and treatment of colorectal cancer, which increases a patient's survival rate. 9, provides for the detection of blood from gastrointestinal lesions that do not bleed every day. 11, ibuprofen, Motrin, Advil, naproxen, Aleve, more than 1 adult aspirin per day, iron supplement, vitamin C supplement greater than 250 milligrams per day. 13, colonoscopy, sigmoidoscopy, a double contrast barium enema radiographic study, and CT colonoscopy. 15, at room temperature, protected from heat, sunlight, and strong fluorescent light, should not be stored in close proximity to volatile chemicals. 15, FIT is more sensitive to the presence of lower gastrointestinal bleeding. FIT is not affected by drugs or food and therefore does not require medication and dietary restrictions. FIT has fewer false positive test results. 19, following a positive fecal occult blood test to determine the source and cause of bleeding, to evaluate patient symptoms related to the colon, such as lower abdominal pain, diarrhea, or constipation, to detect the presence of lesions, polyps, hemorrhoid, fissures, infection, and inflammation. 21, to palpate the rectum for the presence of tenderness, hemorrhoids, polyps, or tumors. Also to relax the sphincter muscles and to prepare the patient for the insertion of the endoscope. 23, to remove secretions such as mucus, blood, or liquid feces which interfere with proper visualization of the intestinal mucosa. 25, sigmoid colon, descending colon, transverse colon, and ascending colon. 27, drink 1 8-ounce glass of liquid laxative solution every 10 to 15 minutes until 2 quarts, 8 8-ounce glasses have been consumed. 29, difficulty in urinating, weak or interrupted urinary flow, pain or burning during urination, frequent urination, blood in the urine, pain in the lower back, pelvis, or upper thighs. 31, prostate cancer, benign prostatic hyperplasia or prostatitis. 33, engage in normal activity for 2 days before the test. Avoid vigorous exercise. do not have sexual intercourse for 2 days before the test. 35. The process of testing an individual to detect a disease in that individual who is not yet experiencing symptoms of that disease. 37. Between the ages of 15 and 34. And 39. History of undescended testicles, family history of testicular cancer, cancer of the other testicle, Caucasian race. All right, remember to send me your results. And then we're going to be starting on chapter 14. So if everyone will turn the books to page 523. And Alicia, can you please read the first and second paragraph for Introduction to Radiology?
Radiology is the branch of medicine that deals with the use of radiation and other imaging techniques, such as ultrasound, computed tomography, CT scans, magnetic resonance imaging, MRI, and nuclear medicine, in the diagnosis and treatment of a disease. A radiologist is a physician who specializes in the diagnosis and treatment of disease using radiation and other imaging techniques. Wilhelm Conrad Röntgen, a German physicist, discovered X-rays on November 8, 1895, while working with a cathode ray tube. He noticed that these rays could pass through solid materials such as paper, wood, and human skin. Because he did not know what they were, he named them X-rays. The rays have since been renamed Roentgen rays after their discovery. However, they are better known as X-rays. Sorry.
It's okay. All right, very good. So you're going to highlight the last sentence in the first paragraph and the first sentence in the second paragraph. Jasmine, can you please read the next two paragraphs?
X-rays are high-energy electromagnetic waves that are invisible and have a short wavelength that enables them to penetrate solid materials. Radiograph is a term used for the permanent image produced by X-rays and recorded on a radiosensitive receptor device such as radiographic film or a digital device. X-rays are used to visualize internal structures and serve as a diagnostic aid in determining the presence of disease. They are especially useful for detecting abnormal conditions associated with the skeletal system, such as fractures. X-rays also are used therapeutically in the treatment of disease conditions, such as malignant neoplasm.
Very good. All right, so you're going to highlight the last sentence in that third paragraph. And Lily, can you go ahead and please read that last paragraph?
An orthopedic medical office may have its own radiograph equipment, but more often radiographs are taken in a hospital or large medical clinic by radiology personnel. Some radiographs, such as chest X-rays, require no advanced preparation, whereas others, such as lower gastrointestinal study, require a great deal of special preparation. Medical assistants are usually responsible for patient instruction in the type of preparation necessary for a particular radiographic examination and for ensuring that the patient understands the importance of the preparation. If the patient does not prepare properly, the radiograph may be of poor quality and procedure may need to be rescheduled. This section introduces the study of radiographs with a focus on the patient's preparation necessary for the common radiographs.
All right, very good. Natalie, can you please read conventional radiology?
X-rays can be taken using the conventional film method or digitally using a computer. When conventional radiographs are taken, radiographic film is loaded into a device known as an X-ray cassette. The cassette is placed behind the part being examined, and a shadow or image of the internal body structure photographed is produced on the film. After the X-ray has been taken, the film must be processed. A radiologic technician takes the cassette into a dark room and develops the image using an X-ray processor.
Very good. All right, you're just going to highlight the first sentence. Sabrina, can you please read digital radiology?
Modern advances in digital imaging technology have made inroads into the field of radiology. The result is the transformation of film-based radiology into a system of computer-displayed and stored digital images. To assist in understanding digital radiology, this transformation can be compared with the replacement of film cameras with digital cameras. Images can be taken and viewed immediately and then sent electronically to a network of computers. Digital radiology allows for increased efficiency and cost savings and better patient care. Higher quality images and ability to manipulate the images and transfer them electronically are important benefits of digital radiology. The medical assistant is responsible for using the medical office computers to access, display, and permanently save images taken by the facilities providing digital imaging services.
Very good. Okay, so you're going to highlight the last sentence on the first paragraph and the second sentence on the second paragraph. All right, Talia, can you please read the first paragraph for contrast media?
Radiology relies on difference in density between various body structures to produce shadows of varying intensity of the radiograph. This is a difference in the density between bone and flesh. Bone is denser than flesh. Bone absorbs more X-rays and does not allow them to reach the radiograph films or digital device. This leaves the part of the radiograph unexposed and causes white areas to appear on the radiograph. If the X-ray penetrates an organ or structure, a black area appears on the radiograph. Because the lungs contain air, X-rays are able to penetrate them easily. As a result, the lung appears black on the radiograph. The ribs absorb the X-rays and appear as white shadows on the radiograph, figure 4.2. A structure such as lung tissues that permits the passage of X-ray is radiolucent. A structure such as bone that obstructs the passage of X-rays and causes an image to be cast on a radiograph is radiopaque. You can keep going now.
Yes, please.
In many cases, the natural densities of two adjacent organs or structures are similar. In this instance, a contrast medium, also known as a contrast agent, must be used to make a particular structure visible on the radiograph. Contrast medias are usually radiopaque chemical compounds that causes the body tissues of an organ to absorb more radiation. This absorption provides a contrast in density between the tissues or organs and the surrounding area. The tissue or organ becomes visible and appears white on the radiograph. Substance used as a contrast medium must be able to be ingested or injected into the body tissues or organs without causing harm to the patient. Contrast medias are administered to the patient through various routes. Some are administered orally, others are injected into a vein or delivered throughout the tracheous, IV line, or the EMA. You want me to keep reading?
Please.
Barium sulfate and inorganic, what's that? Inorganic iodine,
Inorganic iodine.
iodine compounds are commonly used radiopaque contrast media. Barium sulfate is a chalky compound that is water insoluble and does not allow penetration by X-rays. It is frequently used for examination of the GI tract because barium is not absorbed into the body through the GI tract and does not alter its normal function. Iodine salts are radiopaque and are combined with other compounds for radiographic examination of the structures such as the urinary tract, and blood vessels. Iodine contrast media consists of clear liquids and are usually injected. Iodine sometimes produces an allergic reaction before administration. Patients be asked whether they have allergies to iodine. Patients with non-allergy may be given iodine sensitivity test as a precautionary measure.
Very good. Thank you so much. Okay. So in the first paragraph, I want you ladies to highlight if the x-rays penetrate an organ or structure, a black area appears on the radiograph, and I want you to continue highlighting until the last sentence of that paragraph. In the second paragraph, I want you to highlight the second sentence and the last sentence. All right, fluoroscopy. A fluoroscope is an instrument used to view internal organs and structures of the body directly in real time on a display screen. Highlight that sentence. Examination of a patient with a fluoroscope is known as fluoroscopy. A radiopaque medium is often used with fluoroscopy to outline various parts of the body. The patient is positioned between the radiographic tube and a fluorescent screen composed of cesium iodine crystals. When the x-rays pass through the body and strike the crystals, visible light is emitted so that the radiologist can view on a screen the action of body organs or structures, such as the stomach and intestines. During fluoroscopy, the radiologist can take radiographs that permit the study of the structure in detail and serve as a permanent record. All right, case study number 1. Jose Ramirez is a 7-year-old boy with episodes of unexplained abdominal pain and vomiting during the last 6 months. The medical office has scheduled an upper GI radiographic study at the local hospital. Ms. Ramirez wants to know how best to prepare Jose for the procedure so that he will not be afraid of the x-ray room and equipment. She asks what she can do so that he will drink the barium solution. She says he will not drink milk, and if the barium tastes anything like milk, it will be hard to get him to drink the barium. Ms. Ramirez wants to know whether Jose can hold his favorite toy, a Tonka truck, during the procedure to comfort him. She also wants to know whether the barium solution has any side effects. Okay, so what is going to be the first part? What would you do for this patient and his mother?
You should tell him that to prepare for the x-ray that he can eat the night before, just because food and certain liquid make it harder to see what they need to see. So that's why they have him take a specific liquid, just because it's a certain color and shows up better.
Right.
Yeah. I don't really know what it tastes like, so I really can't say anything there. So do you want to help me out there?
Of course. So bariums usually, it doesn't taste like milk, but it is a chalky taste. And I can't tell you what it would remind me of, but it's not milk, but it's. Has anyone ever had like milk of magnesium or even maybe Mylanta, the liquid? Has anyone ever had that?
I haven't.
Okay, if you ever try, it's very similar to that. So it's not that it tastes bad, but it's not something you're familiar with. So for kids, it might be kind of hard for him to want to drink it. You can reassure the mom that it won't taste like milk. But we need to really get Jose to drink it so that way we can get a really, really good picture of his insides the first time. But yeah, it's not milk, but it's not, God, I don't even know how to describe it. And it's not near as bad as what it used to be. It's like going and getting your glucose testing when you're pregnant. That's not near as bad as what it used to be. Yeah, I mean, that'd probably be the only way I could explain it is if you ever try Mylanta or milk of magnesium, like you can kind of taste a little flavor, but it's super chalky. So that would be the best way to do it. All right, what about his toy? Can he bring his toy?
I don't think so. I think it would mess with the image, wouldn't it, if he was holding something? Or no?
Um,
Well, it's not.
so I would let him bring it to the facility. We would just tell the mom that, okay, well, let's leave your toy here and you can come get it as soon as we're done, right? So he has that comfort coming in, but that it's not in the room so it won't interfere with anything. All right, is there anything else?
Um, we could tell her that there shouldn't be any side effects. It really just depends on if he's allergic to iodine or not, but they've tested for that obviously beforehand, I'm sure, are going to. So that he shouldn't worry about that, or she shouldn't worry about that.
Yeah. Um, so iodine is more, so we ask patients when we do any type of imaging that involves like a barium or a CT contrast, more so CT contrast, we ask about iodine allergies. So yes, more likely we've already asked and he's not allergic. Now, barium, because it is a heavy liquid, right? And we do have to ingest it. Most common, maybe a little nausea, diarrhea, and or constipation as it passes through the body. That's usually about the only thing, but it also kind of keeps you full. It's like, I'm trying to figure out a good way to explain it. Let's say you drink a whole Dr. Pepper really fast. All right, you know how it kind of makes you that bloated, just super full and kind of weird feeling? That's what it's kind of like drinking the barium. So for the most part, really not too many side effects, but I would tell them that, he may kind of feel a little nauseated or maybe constipated. Because barium is a white colored substance, um, ironically, your stool may turn white as well. So fun facts on this one. All right, very good. Any questions? Okay. So positioning the patient. The position of the patient is determined by the purpose of the examination and the area examined. The patient is generally positioned so that several different views can be taken to provide a complete three-dimensional picture of a part examined. Articles such as jewelry and hairpins must be removed so that the image on the radiograph is not obscured. To prevent blurring of the image on the radiograph, patients must maintain the position in which they are placed and not move during the radiograph examination. Highlight that sentence. Blurring prevents good visualization of the part and may warrant retaking of the radiograph. The following types of radiographic views are used, and the methods used to position the patient for each are described. Okay. So you remember we already have positions that we would place our patients for certain examinations, like we have our lithotomy, we have our SIMS, we have our prone, we have our supine. Well, the same thing goes for x-rays. And I say x-rays, but it's also any type of radiograph imaging. You may be responsible to explain to the patient the position and instruct them on how to get to that position. So Alicia, can you please read the different views?
The anterior-posterior AP view. The X-rays are directed from the front toward the back of the body. The patient is positioned with the anterior aspect of the body facing the radiograph tube and the posterior aspect facing the film or digital device. Posterior PA view. The X-rays are directed from the back toward the front of the body. The patient is positioned with the posterior aspect of the body facing the radiograph tube and the anterior aspect facing the film or digital device. The lateral view. The X-ray beams pass Beam passes from one side of the body to the opposite side, the right lateral RL view. The right side of the body is positioned next to the film or digital device, and the X-rays are directed through the body from the left to the right side. Left lateral view (LL). The left side of the body is positioned next to the film or digital device, and the X-rays are directed through the body from right to left. Oblique view. The body is positioned at an angle or in a semi-lateral position. The supine position, the patient is positioned on the back with the face upward. The prone position, the patient is positioned on the abdomen with the head turned to one side.
All right, very good. So I want you ladies to highlight the first sentence on both the anterior, posterior, anterior, and lateral view. So anterior, posterior, remember this is what we consider the inside frame. So this is anterior. And then posterior is going to be your back. Posterior, anterior is where we're just going to flip, right? We need to go from back to in. Lateral view, it goes from one side to the opposite side. Specific radiographic examinations. The medical assistant should understand the purpose of commonly performed radiographic examination and should be able to instruct a patient on the proper preparation for each. Frequently performed radiographic examinations and the special advanced preparation necessary for each are described. The preparation may vary depending on the medical office. Okay, so I've had a lot of you over the last several weeks, they've asked me about x-rays. Do we do x-rays? I am going to show you the basics info on the any type of your radiology and diagnostic imaging. It will be based up to the facility that you're at, if they do x-rays and if they train you. But just like with everything else, we have to be able to assist in providing the instructions for our patients. And that's what this is really all about. You need to be able to know the common imaging so you know what it's about. You can answer questions and also give directions to the patient. Any questions on that? And okay, so our first one's going to be mammography. One of my favorites. Let's see here. Jasmine, can you please read the first and second paragraph?
Mammography is a radiographic examination of the breast used to detect many forms of breast disease, such as benign breast masses, breast calcifications, fibrocystic breast disease, and particularly breast cancer. It also is used to monitor the effects of surgery and radiation therapy on breast tumor. Mammography uses low doses of X-rays that pass through the breast and create an image on film or digital device. On the radiograph, an abnormal area appears noticeably different from normal breast tissue. Mammography can be used to detect a breast tumor when the growth is less than 1 centimeter in diameter, about the size of a pea, and before it is clinically palpable. A malignant lump might be removed at an early stage. This usually results in conservative treatment with less disfigurement and a high survival rate. With early diagnosis and treatment, breast cancer survival rates for women can reach as high as 94%.
All right, very good. Okay, in the first paragraph, I want you ladies to highlight the first sentence. All right, now, has anyone had a mammogram done? For any reason. Some of you probably aren't of the screening age, but that doesn't mean you may not have had one done. Have any of you ladies had one done? Okay. How about any family members? Have you heard that they have gotten them done? Yeah, probably. All right, thank you, Lisa. Anybody else? Okay. So mammograms are, we talked on a chapter about our BSE, right? What is our BSE?
Self-breast examination.
That's right. That is the first step of our diagnosing, right? We become familiar with our body. Let's say for whatever reason we feel something that doesn't seem right. We go to our doctor and they may be able to feel it. If they do, they may order your patient a mammogram. Now, there are several different things that can warrant having a mammogram done, but it does not mean that it is cancerous, and it does not mean that it's a bad thing. And it is very, very, very important. And it does not go for just female patients. It also goes for our male patients, that we advise them that it's just better. Let's just go ahead and take a picture of it, right? Let's get some imaging and let's just make sure that everything's doing okay. If there's a lot of things that can cause a warrant for mammogram. Breast disease, benign breast masses, breast calcification, fibrocystic breast disease, and particularly breast cancer. Does anyone know what these things are? Okay. So you can form lumps or masses, and it is just that. It is benign. In most cases, though, it will be able to be viewed on a mammogram and or an ultrasound. And sometimes a doctor may want to do a biopsy, but again, that does not mean that they're cancerous. For our breast, early detection is by far the best. So again, it could be benign, and that's what we all hope for. Breast calcifications and fibrocystic. So sometimes our breast will form a little hard pea size, like many little lumps in our breast. That's where those two categories come in. If you're one that drinks a lot of caffeine, you may feel these in your breast, and that's purely because it's off of caffeine. If you reduce your caffeine intake, you'll find that you won't feel the cyst in your breast. If you are prior to and or at the end of a menstrual cycle, you may feel changes in your breast, and that's why you always want to follow up maybe a few weeks later, and 9 times out of 10. All right. Any questions on that so far? Okay. Lily, can you please read the next 2 paragraphs?
No specific preparation is necessary for mammography. The patient should not wear any lotions, powders, or deodorants because they may contain small amounts of metal that can be seen on the radiograph and may interfere with her preparation. For mammogram, the patient must remove clothing and waist stuff. The patient should be told to wear two-piece outfits so that the procedure is easier and more comfortable. A radiology technician generally performs the mammogram. The patient's breast is positioned on the mammography platform and pressure is applied with a plastic compression paddle that flattens the breast. Compressions of the breast is necessary to obtain your radiograph and to lower the radiation dosage as much as possible. During the procedure, the patient must hold her breath and remain still momentarily because any type of motion, even breathing, can blur the image and make a repeat radiograph necessary.
All right, very good. So in that first paragraph, I want you ladies to highlight the first 2 sentences. And in that next paragraph, I want you to highlight the 3rd sentence. 2 radiographs are taken of each breast, one from above and one from the side. A radiologist then checks the mammogram and occasionally orders additional images to obtain a more complete view of the breast tissue. After the procedure, the radiologist studies the mammogram for any signs of breast cancer or other breast problems and sends a written report of the findings to the patient's physician. All right, really quickly, we're going to look at figure 14.4 and 14.5. So 14.4 is the patient positioning for mammography. And it's almost like a little thing. It clamps down on the breast, and it is not comfortable by all means. 14.5, this is a mammogram. The arrows indicate suspicious area of increased density that needs further attention. So this is what the breast tissue looks like on a mammogram. All right, any questions on that?
I have a question.
Yes, ma'am.
So, what about the women that have really, really small breasts? Can they still do that?
Yes.
Oh,
Yes, they do. So if you look on page 14, not page, figure 14.4, do you see that clear tray that is above the breast? That comes in different sizes, and that's made for patients with different size breasts. So let's say you have a small breast, then your plate probably would be smaller, so that way it can squeeze down on it from top to bottom, and it's, and it gives just as great imaging. But yes,
okay. Thank you.
you're welcome. All right, bone density scan. Let's see. Natalie, can you please read the first and second paragraph for bone density scan?
A bone density scan is an enhanced form of X-ray technology that measures the bone mineral density of the human skeleton to detect bone loss. As individuals age, their bones become less dense, causing them to become brittle and weak. This may lead to a bone fracture. Factors that cause bones to lose density include osteoporosis, thyroid and parathyroid conditions, and certain medications. For example, corticosteroids.
Mm-hmm.
Postmenopausal women are at particular risk for osteoporosis. Therefore, it is recommended that women above the age of 65 have a bone density scan every 2 years. Osteoporosis is a condition in which a gradual loss of calcium causes the bones to become thinner, more fragile, and more likely to break. Dual energy X-ray absorptiometry (DXA) scanning is the most widely used bone density testing method. DXA, pronounced DEXA, uses X-rays to determine the amount of bone in the human skeleton. During a DEXA scan, bone density measures are taken at different parts of the body. The bone density measures indicate if the patient has lost bone density. They also assist in detecting the presence of osteoporosis and can be used to predict the patient's risk of bone fracture. Patients on medication therapy for osteoporosis, for example, Fosamax, Boniva, may also undergo DEXA to determine if the therapy is working.
Very good. All right, in the first paragraph, I want you ladies to highlight the first sentence and then highlight where it says postmenopausal women are at risk for osteoporosis. All right, Sabrina, can you go ahead and read the next paragraph, please?
The patient should be instructed to abstain from taking a calcium supplement or osteoporosis medication on the morning of the examination. These substances interfere with obtaining an accurate measurement of the bone density. To perform the examination, the patient is positioned on an X-ray table and is instructed to remain as still as possible during the test. The radiologic technician then scans one or more areas of the bone with the DXA equipment. Areas that are typically scanned include the lower spine and hips. Do I keep reading the next one?
You can if you want.
Test results are in the form of 2 scores, which are sent to the patient's physician. These scores assist the physician in diagnosing and treating the patient. The T-score is derived by comparing the patient's measurements with those of the healthy young normal adults with peak bone mass of the same gender and ethnic group as the patient. A score above 1 is considered normal. A score between 1 and 2.5 is classified as osteopenia or low bone mass. A score below -2.5 is defined as osteoporosis. The T-score is used to estimate the patient's risk of developing a fracture. The Z-score is derived by comparing the patient's measurements with the established database of normal individuals as the same age, gender, and ethnic group as the patient. An unusually high or low Z-score may indicate the need for further testing.
All right, very good. All right, so I want you ladies to highlight on that first paragraph, the first sentence where it says the patient should be instructed to abstain from taking a calcium supplement or osteoporosis medication on the morning of the examination. So mammogram is imagings of the breast. Bone density scan is imagings of our bones throughout our body. Usually you are laid flat on a table. They may put something underneath the back part of your leg so it kind of raises up. Some imaging will only do the hips and the spine and maybe the legs. Some imaging, they'll do the whole body. And they'll send the results back. And it just is going to detect if there's any, if we're losing any loss in our bone, because that could lead to serious injuries. All right, any questions on that? And it does not hurt to get the exam done, or the test. Okay, next is our gastrointestinal series, or upper GI. Talia, can you please read just the first paragraph?
An upper GI is UGI is an examination of the upper digestive tract using fluoroscopy and radiograph. The examination is helped in the diagnosis of orders of the esophagus, stomach. What's that? Duodenum? What's that deal?
Duodenum.
Duodenum and intestine. Gastrographical reflux disease, GERD, heterohernia, pectoralis, beam, and malignant tumors. The process during may be ordered when the patient complains of different difficulty in the swallowing, vomiting, abdominal pain, gastric reflux, burping up food, serve indigestion, and blood in the stool.
All right, very good, thank you. Okay, so I want you ladies to highlight where it says an upper GI, or UGI, and then highlight the examination is helpful in the diagnosis of the disorders of the esophagus, stomach, duodenum, and small intestine, gastroesophageal reflux disease, GERD, hiatal hernia, peptic ulcer, benign and malignant tumors. So remember last chapter we touched on a colonoscopy, right? Our colonoscopy basically is visual imaging of our abdominal, our colon area. Okay, well, we have to have imaging up here, right? Because we can develop diseases and illnesses up here. That's where this test is really good, that comes into play. So, and it's really just like our colonoscopy, the images are awesome. So is our upper GI. All right, any questions on that so far? All right, Alicia, can you please read the next two paragraphs?
Proper patient preparation is important for this procedure. The patient's stomach must be empty at the beginning of the study so food does not obscure the radiographic image. To prepare for this examination, the patient must eat a light evening meal and then not eat or drink anything, including water and medications, after midnight on the day before the examination. Food and fluid in the GI tract have a degree of density and could cause confusing shadows on the radiograph. The stomach varies little in density from the structures around it, and to make it show up on a radiograph, a contrast medium must be used. The patient drinks a suspension of barium mixed with water and flavoring, which resembles a milkshake and has a chalky taste. Before drinking the barium, the patient may be asked to drink a carbonated beverage that consists of baking soda granules. The solution puts stomach in the air, causing it to expand. The combination of air and barium allows the radiologist to view the stomach in greater detail.
All right, very good. So in that first paragraph, I want you to highlight, to prepare for the examination, the patient must eat a light evening meal and then not eat or drink anything including water and medications after midnight on the day before the examination. Okay. So remember I said that the barium has a chalky taste, right? Well, they also give you these little crystals that makes you think that you're drinking a Dr. Pepper. And then they place you in different positionings, taking pictures as that barium and carbonated substance flows through your upper GI area. And then they take pictures. That's pretty cool. The barium does taste better than the carbonated thing that they mix. Ugh. All right, very good. Jasmine, please read the next paragraph.
As the patient swallows the barium mixture, the radiologist observes its passage down the esophagus and into the stomach and duodenum with fluoroscopy. The barium coats the lining of the gastrointestinal tract, making it visible on the screen with the fluoroscope. Radiographs are taken periodically during the examination to allow a detailed study of the upper GI tract and to provide a permanent record. The patient's position is changed at various times so that the upper digestive tract can be visualized from different profiles. If the radiologist wants to observe the passage of barium through the small and large intestines, the patient must wait at the facility and return to the radiology examination room several times for additional radiographs. After the procedure, the radiologist prepares an upper GI report of the findings, which is sent to the patient's physician. Do I keep reading?
Very good. No, you're good.
Okay.
All right, so you're going to highlight the first sentence and the third and fourth sentence. So if the radiologist is wanting to just do the upper portion, then that's a pretty quick examination, and you do kind of have to turn a lot, which kind of makes you a little old, but if the doctor's wanting to go further, then we have to allow for that barium. So you have to think that when you drink this substance, it's almost like a highlighter, right? It highlights everything as it's passing through. So if we want to do lower pictures, we need to wait a little further, wait more time so that the highlighter goes through all the other body parts, and then we again take pictures of that. All right, the medical assistant should explain to the patient that the barium suspension will appear in the stool for 1 to 3 days following the procedure and will cause the stool to have a whitish color. Highlight that sentence. The barium mixture may cause constipation and the need for a laxative. To help prevent constipation, the patient should be instructed to increase fiber and fluid intake for several days following the procedure. So in most cases, if a patient will drink lots and lots and lots of water for the first few days, that helps a lot and helps kind of flush it out of the system. But occasionally you do need to take something. All right, any questions on that? In case you haven't noticed, this is also one of my favorite chapters. All right, lower gastrointestinal radiography. Lily, please read the first paragraph.
A lower GI filling the colon with the barium sulfate mixture with a catheter tube inserted into the rectum through the anus. Because of this, the procedure is sometimes called the barium enema. The examination uses fluoroscopy and radiography to observe and obtain permanent pictures of the colon and rectum. A lower GI assists in diagnosis of disorders of the colon, such as polyps, cancers, tumors, diverticulosis, and extent of inflammatory bowel disease. The colon must be thoroughly cleaned in advance to remove gas and fecal material. Gas has a certain degree of density and shows up as confusing shadows on the radiograph. If fecal material appears on the radiograph, the image of the colon is
All right, very good. Okay, so you're going to highlight the first sentence and then highlight where it says a lower GI assists in the diagnosis of disorders of the colon, such as polyps, cancerous tumors, diverticulosis, and the extent of inflammatory bowel disease, for example, ulcerative colitis and Crohn's disease. Highlight the words to remove gas, and gas has a certain degree of density and shows up as confusing shadows on the radiograph. Okay, so I asked a question, do you ladies know what an enema is? I just need to know a yes or no, and if you answered no, not a big deal. I want to be able to explain it because, again, you have to be able to explain this to your patients. Okay. Okay, Alicia, since you were the one that kind of said that you do think so, can you please explain what you think an enema is?
It's a procedure where they inject a liquid or a gas to pretty much clean out the rectum.
Okay. Is this something that you can do at home?
Yeah.
Yes. So a lot of times an enema you can buy over the counter. They're like little capsules that you would insert in the rectum, and it basically it helps in the assist of cleaning out your colon. Okay. So just like we use a barium in our upper GI, you would use barium for the lower GI. And again, it does the same thing. So we want to clean it out, but we also want to highlight those areas. So that's why they refer to it as a barium enema. So we're wanting to do both. But it doesn't hurt at all. Let's see. Okay. Natalie, can you please read the next paragraph, please?
Where it says the patient should report.
No, where it says instructions for cleansing.
I'm lost.
On page 529. It's the very first paragraph under figure 14.6 and a picture of a lower GI.
Oh, instructions for cleansing the colon may vary from one medical office to another, but in general, the patient is instructed to consume only clear liquids the day before the examination, such as water, plain coffee, and tea, clear broth, and strained fruit juice. A laxative should be taken on the day before the scheduled examination, and enema also may be necessary. An enema is an injection of fluid into the rectum to aid in the elimination of feces from the colon. The patient should not drink anything except water after midnight on the day before the examination. On the morning of the examination, the patient may be required to perform a warm water cleansing enema until the returns are clear.
All right, very good. All right, so highlight the first two sentences and then highlight where it says the patient should not drink anything except water after midnight on the day before the examination. All right, Sabrina, can you go ahead and read the next two paragraphs?
The patient should report at the scheduled time and is instructed to relax on one side while the rectal catheter is inserted. As the barium enters the colon, the radiologist watches it on the fluoroscopic screen and periodically takes radiographs. The patient has a sensation of fullness and the urge to defecate as the barium enters the colon. The catheter usually has a balloon on the tip of it and to prevent the barium from coming back out. The patient is moved into various positions to allow the barium to fill the colon completely and to obtain better visualization of the colon. The patient is allowed to evacuate the barium and another radiograph is taken to finish the radiographic examination. After the procedure, the radiologist prepares a lower GI report of the findings, which is sent to the patient's physician. A double contrast barium enema radiographic study is similar to a lower GI study. However, in addition to the barium, it also employs the use of air that is inserted into the colon through the same catheter as the barium. The air distends the wall of the colon and allows the radiologist to view the colon in greater detail, making it easier to detect the polyps and small cancerous tumors.
Very good. Okay, so you're going to highlight where it says a double contrast barium enema radiographic study is similar to a lower GI study. However, in addition to the barium, it also employs the use of air that is inserted into the colon through the same catheter as the barium. So let me ask this. Could your doctor order a lower GI or a double contrast barium enema instead of doing a colonoscopy? Yes. Yes, they can, because these are other testing that can be done rather than doing a colonoscopy. All right, very good. Any questions on that? Okay, so now we're going to go on to intravenous pyelography. An intravenous pyelogram, IVP, is a radiograph of the kidneys, ureters, and bladder. Highlight that sentence. An IVP is used to assist in the diagnosis of kidney stones, blockage or narrowing of the urinary tract, and growths within or near the urinary system. Highlight that sentence. The patient should consume only clear at 4 p.m. the day before the examination. The evening before the examination, the patient must take a laxative such as magnesium citrate or Dulcolax tablets to remove gas and fecal material from the intestines. Removal of gas and fecal material permits proper visualization of the urinary tract. Starting at midnight the day before the examination, the patient should not eat, drink, smoke, or chew gum. Highlight, unless the patient is allergic to iodine, a contrast medium consisting of iodine is used and administered intravenously to the patient. As the iodine enters the bloodstream, the patient may feel a warm and flushed and have a metallic or salty taste in the mouth. This reaction is normal and lasts only for a few minutes. If the patient has iodine, a different type of contrast medium must be used. After the procedure, the radiologist prepares an IVP report of the findings, which is sent to the patient's physician. Okay, Nancy, yes, we're on page 530, and we're about to start other types of radiographs. Okay, so if at any time that your patient has to do contrast, and they ask you, what side effects am I going to feel? Okay, when they start the contrast through the IV, you do get a super warm sensation, like instantaneously throughout your whole body, and almost kind of feels like you might need to go pee, but you don't. That's just a sensation of the contrast. So it's really weird, but it literally only lasts for a few seconds. All right, other types of radiographs. Other types of radiographs that the medical assistant may encounter include the following: angiocardiogram, bronchogram, cerebral angiogram, cholangiogram, coronary angiogram, cytogram, hystersalpingogram, myelogram, and retrograde pyelogram. All right, so that's going to cover our radiology side, right? Now, more of a diagnostic side. So, introduction to diagnostic imaging. Diagnostic imaging procedures are performed frequently because they allow for the visualization of internal body structures in great detail. The diagnostic imaging procedures are ultrasonography, US, computed tomography, CT, magnetic resonance imaging, MRI, and nuclear medicine. Diagnostic imaging procedures are usually performed in a hospital or a large clinic. The medical assistant, however, may need to relay information to a patient scheduled for such a procedure, including what to expect during the procedure and any patient preparation that may be required. The medical assistant should have a basic knowledge of diagnostic imaging procedures and the preparation necessary for each. All right, Talia, can you please read the first paragraph on ultrasonography?
Ultrasonography is called ultrasound. It is the oldest diagnostic image procedure. Ultrasound uses high frequency waves for the study of soft tissue structures. Advances have been made in the ultrasound technology. These include three-dimensional 3D ultrasounds in which sound waves are formatted into 3D images, figure 14.8. Four-dimensionals 4D ultrasound is another new technology that consists of 3D ultrasound but in motion.
All right, very good. So you're just going to highlight the words ultrasound. All right, Alicia, can you please read the next two paragraphs?
An ultrasound examination, right? That's right?
Ultrasound is frequently used.
Oh, okay. I thought you were at two. Okay. Ultrasound is frequently used in the diagnosis of conditions of the abdominal and pelvic organs, particularly the liver, gallbladder, spleen, pancreas, kidneys, uterus, ovaries, and abdominal aorta. Some examples of conditions that can be detected using ultrasound include breast cysts, gallstones, and kidney stones. An ultrasound examination of the heart is called an echocardiogram and is used to determine the size, shape, and position of the heart and the movement of the heart's valves and chambers. Ultrasonography is also used for guiding a needle or other devices during the minimally invasive procedures such as an amniocentesis, a needle biopsy, cortisone injection into a joint, and needle aspiration of fluid in the joint.
Very good. All right. Jasmine, can you please read the next paragraph?
Ultrasonography offers many advantages as a diagnostic imaging procedure. It shows movement, allows continuous viewing of a structure, uses sound waves rather than radiation, and is less expensive than other imaging procedures. Ultrasound does have some minor limitations. Because sound waves are unable to penetrate bone and air or gas-filled cavities such as lungs, stomach, and intestines, ultrasound cannot be used in the evaluation of these structures. In addition, ultrasound may be difficult to use with obese patients because adipose tissue can interfere with sound wave transmission.
All right, very good. So I want you ladies to highlight the second and third sentence. All right, Lily, can you please read the next paragraph?
Before performing an ultrasound examination, a warm ultrasound gel must first be spread on the area to be examined. The purpose of the gel is to increase conductivity of the sound waves between the skin and the transducer. During the ultrasound examination, the examiner places a probe containing a transducer firmly on the patient's skin and moves it over the body areas to be examined. The transducer generates sound waves that are directed into the patient's tissues. The sound waves are reflected back to the transducer similar to an echo. These sound waves are then transmitted to the ultrasound machine through a cable where a computer converts them into an image. The size, shape, and consistency of the image are displayed on the video display screen. This image is known as a sonogram. The patient is often permitted to view the sonogram on the screen of the monitor as the procedure is performed. Selected images can be permanently recorded or on film or computerized storage media. A radiologist reviews and interprets the images and prepares an ultrasound report that is then sent to the patient's physician.
All right, very good. So I want you to highlight where it says the size, shape, and consistency of the image are displayed on a video display screen. This image is known as a sonogram. All right, Nancy, are you where you can read our next paragraph?
Yes, but I'm trying to find where you said the highlight.
The size, shape, and consistency of the image are displayed on the video screen. The image.
There it is. I found it. Thank you. Okay. Although ultrasound is commonly used for a wide variety of non-invasive imaging procedures, individuals are most familiar with its use in obstetrics. How do you say that? Obstetrics.
Obstetrics. Yep.
Okay. Obstetrics ultrasound is most frequently used to determine the gestational age of a fetus and to confirm the due date. To detect congenital abnormalities, ectopic pregnancy, the multiple pregnancy, and to determine the fetus position and size late in pregnancy. If the fetus is old enough and is positioned correctly, it also may be possible to determine its gender. Because the ultrasound machine is a compact unit, most obstetricians perform this procedure in their medical offices. Ultrasound is also used by a gynecologist to evaluate and treat infertility problems.
Very good. All right, so you're going to highlight where it says obstetric ultrasound is most frequently used to determine gestational age of a fetus and to confirm the due date, to detect congenital abnormalities, ectopic pregnancy, and multiple pregnancies, and to determine the fetus's position and size late in pregnancy. All right, let's see. Natalie, can you go ahead and read the next paragraph, please?
Doppler ultrasound is a special application of ultrasound. It measures the direction and speed of blood as it flows through the blood vessels, such as major arteries and veins in the abdomen, arms, legs, and neck. Doppler ultrasound images can assist the physician in diagnosing blood flow blockages, narrowing of blood vessels due to atherosclerosis, and congenital malformations.
All right, so then you're going to highlight that first sentence. All right, patient preparation. The medical assistant should tell the patient what to expect during an ultrasound examination and instruct the patient in preparation required for the procedure as follows. Number one, ultrasound is a safe and painless procedure that takes approximately 15 to 45 minutes to complete, depending on the body part examined. Number two, the patient may need to prepare for the procedure depending on the part of body examined. An ultrasound of bladder, liver, spleen, and pancreas necessitates that the patient fast for 8 to 12 hours. For an obstetric ultrasound, the patient needs to have a full bladder. The patient should be instructed to consume approximately 30 ounces of fluid about 1 hour before the procedure. Number three, the patient must remain still when requested during the procedure because movement can interfere with accurate results. In addition, the patient may be asked to change position so that the organs can be seen at different angles. All right, case study number two. It kind of does sound like that. All right, Sarah Jane Monnery has been having heart palpitations. The physician ordered an electrocardiogram and the results did not show any abnormalities. The physician then ordered a Holter monitor. Results show that the patient was having premature ventricular contractions, especially in the evening. The physician suspects that Sarah Jane has a prolapsed mitral valve and has scheduled an echocardiogram at the local hospital. Sarah Jane wants to know whether this procedure involves injecting a dye into her veins. She also wants to know whether the procedure will hurt. 2 days before the appointment for the electrocardiogram, Sarah Jane calls the medical office to say that she just found out that she is pregnant and wants to know whether the procedure will have to be canceled. All right, first part, what would you do?
Explain the procedure to her and let her know what's gonna happen. I don't believe that she won't have to get a dye injected because it's an echocardiogram, so it's kind of like a sonogram, right? It's not like they don't have to inject anything, do they?
Correct.
Okay. So yeah, so it's probably, I'm pretty sure it's safe for pregnancy because they use stuff like that to look at your baby and stuff.
Yeah.
So I guess just explain that to her to make her feel comfortable.
Yeah, and that pretty much covers it. I mean, so you basically tell her, it's very similar to an ultrasound. So there's no dye, really no pain, that will be associated with it. So the big thing on this one though is, what do we not want to do?
Tell her that she has a myocardial infarction.
One more time.
Because the doctor said she suspects that she has. I'm sorry, I'm not by my book. I came in another room real quick. But the doctor said that since she had the Holter monitor, that she suspected that she had whatever. I forgot what it said, but not tell her that she has that.
No, probably more than likely. Now, because it doesn't actually state it, I'm just going to go on the assumption part here that the doctor's already informed her maybe what the Holter monitor says, and that's why we're proceeding with a different type of imaging to confirm what he suspects is going on. But the one thing on this one, that because we know that an echocardiogram is very similar to an ultrasound, that it's going to be safe for her since she just found out she was pregnant. We don't want to tell that to her without confirming with the doctor, because sometimes your doctor may say, no, you know what, let's just, maybe let's let her see her OBGYN and confirm, whatever it may be. But we definitely don't want to just go ahead and tell her anything without talking to the doctor first. Even though we already kind of know, right? But we don't want to do that. All right, any questions on that? All right, computed tomography. Let's see here. Alicia, can you go ahead and read computed tomography? I suppose.
I'll read.
All right, yay, go ahead and read it.
Computed tomography is an advanced radiographic examination that uses only a minimal sectional images of a body part, permitting the imaging of structures that cannot be visualized with the conventional radiographic procedure. A CT scan allows the radiologist to view the bones and organs of the head and body in fine detail and has been used most successfully in diagnostic studies of the brain, abdomen, and pelvis. CT scans are used primarily to detect and evaluate tumors and other abnormalities and to monitor the effects of surgery, radiation therapy, or chemotherapy on tumors. The scan is conducted by the skilled diagnostic imaging technician. The patient is positioned on a special motorized table from an adjoining room. The technician mechanically moves the table into the donut-shaped device known as a CT scanner until the part of the body to be examined is inside the tubular opening of the scanner. During the scan, two examinations are often performed. The first examination is a plain scan, and the second is a repeat scan after the contrast medium has just been injected through the vein in the arm. The contrast medium makes possible a sharper image of internal structures of the body. The X-ray tube within CT scanner rotates around the patient, taking multiple radiographic images in a rapid sequence at different angles. The series of radiographs is processed with a computer to produce cross-sectional images of a body part similar to the slices of bread in a loaf. These images are permanently recorded on film or stored digitally on electronic media for evaluation by the radiologist. The radiologist reviews and interprets the images and prepares a CT report, which is sent to the patient's physician.
All right, very. Okay, so in the first paragraph, I want you to highlight the first sentence and the third sentence. In the third paragraph, I want you to highlight the first two sentences. All right, patient preparation. Sabrina, can you go ahead and read patient preparation?
The medical assistant should tell the patient what to expect during the CT scan and should instruct the patient on the preparation required for the procedure as follows. Before the procedure, the patient must remove all radio peg objects such as dentures, eyeglasses, and jewelry because they interfere with clear image of the body part examined. If a contrast medium is used, the patient may need to fast for several hours before the procedure. It is important to ask the patient whether he or she is allergic to radiographic contrast media to avoid an adverse reaction. The patient should lie motionless and breathe normally during the procedure. When a radiograph is being taken, the patient is usually asked to hold his or her breath so that the radiograph is not blurred. The patient hears mechanical clicking and wiring sounds from the scanner as pictures are taken. Depending on the body part being examined, the procedure takes from 10 minutes to an hour to complete.
Very good. Okay, so I want you to highlight the first sentence in number 1 and the first sentence in number 3. All right, magnetic resonance imaging, MRI. Talia, can you read the first paragraph?
Computer tomograph.
No, the MRI on page 533.
Thank you. Which page?
On page 533, magnetic resonance imaging.
Oh, okay, sorry. MRI is used for imaging tissues of high fat and water content that cannot be seen with other radiology techniques. MRI assists in the diagnosis of intracranial and spinal lesions and cardiovascular and soft tissues abnormal such as coronary disease and joint diseases. MRI allows the examiner to see through bones and view the filled soft tissues in great details.
Very good. Okay, so I want you to highlight the last two sentences on that paragraph. All right, Alicia, go ahead and read the next two paragraphs.
MRI is a safe and painless procedure in which a strong magnetic field and ordinary radio waves produce computer processed images of internal body structures. Because MRI does not involve radiation, the U.S. Food and Drug Administration has classified the MRI machine as a low-risk device. The patient lies on a table inside the bore of a a cylindrical MRI machine, while a diagnostic imaging technician is in an adjoining room monitors the procedure. Figure 14.12. Because of the close space, some patients may have difficulty with claustrophobia. The physician may order a sedative for those patients. Open MRI machines are less confining than traditional MRI machines. However, they are newer technology and may not be available at some facilities.
Very good. All right, in the second procedure, I just want you to highlight that an MRI is a safe and painless procedure. Jasmine, can you go ahead and read the next paragraph, please?
The high-resolution three-dimensional images that are obtained with MRI are permanently recorded on film or stored digitally on electronic media for evaluation by a radiologist. The radiologist reviews and interprets the images and prepares an MRI report, which is sent to the patient's physician.
Very good. All right. I'm going to go ahead and read patient preparation, and then we're going to read case study number 3. The medical assistant should tell the patient what to expect during the MRI and instruct the patient preparation required for the procedure as follows. Number 1, highlight MRI as a safe and painless procedure with usual completion time between 20 minutes and 1.5 hours. Number 2, no special preparation is necessary for the MRI examination. The patient may eat or drink before the examination and take any prescribed medication. The patient should wear loose, comfortable clothing such as a jogging suit for the procedure. Number 3, because the procedure involves a strong magnetic, the patient should remove any metal or magnetic sensitive objects such as hairpins, eyeglasses, hearing aids, watches, rings, and credit cards. Avoid wearing cosmetics, as certain types of cosmetic procedures contain small amounts of metal. Individuals with a pacemaker or an inner ear implant may not be able to undergo an MRI. That is very true. Number 4, a contrast medium may be used for the procedure. It improves the resolution of the image by increasing the brightness in various parts of the body. Number 5, the patient must remain completely still for 15 to 20-minute intervals during the procedure. The patient hears a metallic clacking sound like a muffled drumbeat. Highlight those 2 sentences during the procedure. Earplugs or headphones are available for use if the patient desires. All right, so again, you need to be able to know what preparation involves for what your doctor is ordering. So if your doctor is ordering an MRI, make sure you ask the patient, do they have any metal in their body? Mouth, hip, bones, pacemaker, anything. Also ask them if they are claustrophobic, because we can go and prescribe them something to kind of help relax, or if possible, we may transfer to an open MRI just to kind of help with ease that process.
So if they have metal in their body, what happens?
Well, because it's magnetic, it's going to pull that metal, and you don't want that.
Right. So, I mean, what do they do in circumstances like that? And
most of the time, they will not do an MRI. They'll change it to a CT scan.
oh, okay.
Yeah. Yep. All right. Michael Wendell is an 18-year-old high school varsity football player. For the past 3 months, he has had pain and swelling in his left shoulder. The physician schedules an MRI to assist in determining the cause of the problem. Michael has had several radiographs over the past 2 months and is worried that the radiation exposure to his body. He wants to know how much radiation will be involved with the procedure. Michael has problems with claustrophobia and wants to know whether he can play a game on his iPhone during the procedure to distract him. He also wants to know whether he's allowed to eat anything before the procedure. Okay, so what do you do?
Well, one, we don't allow him to play a game during the procedure.
Right, and really, because it's on his iPhone, which is going to cause problems with the MRI machine.
Right.
Yep.
And of course, maybe prescribe something for his claustrophobia.
Hmm.
We want to let him know that we understand that he's worried about the risk of radiation, but the MRI machine does not have any radiation, so it's completely safe. He can eat and drink or anything before the procedure, however he wants to. That's fine. And if he doesn't want a sedative, like you said, if it's possible, we can move him to an open MRI to make him more comfortable.
That's right. Yeah. So so MRI has really, it's really awesome, right? It doesn't use radiation. You get great images, but not everybody can do that, and not many. Depending on where your physician orders, not many facilities have the open MRI. So if your doctor says, yeah, we can switch to an open MRI, as a medical assistant, you need to be able to contact where the patient is getting the testing done and see if they have an open MRI. And if not, we need to find another facility that the patient goes to for the testing. Yeah, eat and drink. He can't play on his phone, but we sure can hand him some headphones. That usually helps. So, yeah, very good. So this one's a pretty easy one. But if you've never been in an MRI, so a lot of patients, they say that they're claustrophobia or claustrophobia. And an open MRI, like imagine you, has anybody ever been in a tanning bed? Maybe not, but you've seen them, right? All right, so imagine that, but in a much like complete circle, and it's more closed in. So that's where the patients kind of start feeling a little claustrophobic because they're super. There's not a lot of room. But the open MRI actually allows more of a. It's an opening, and the machine goes more around the patient and do what they need to do. Yeah, I don't. Yeah, well, yeah, that's true. I don't ride behind semi trucks with um, wood in the back of it because I've seen that way too much. All right, very good. Any questions up to this point? We're almost done. So, yeah, MRI is the one testing that I actually have not had done, and I cannot, no matter how much my cardiologist says that there should not be any problems, but because of my pacemaker, nobody will touch me in an MRI machine. So that's the one test I really can't tell you from personal experience about. All right, nuclear medicine. Let's see here. Jasmine, can you read the first paragraph, please?
Nuclear medicine is an advanced diagnostic imaging procedure in which a tiny bit of radioactive material is introduced into the patient. The radiation is introduced into the body by a diagnostic imaging technician using one of the following methods: intravenously, by ingestion, or by inhalation. The technologist positions the patient on a scanning table that works in association with a specialized piece of equipment known as a gamma camera. The gamma camera is positioned above or below the scanning table and is able to detect the radiation being given off by the body part that has been targeted by the radiation. This is accomplished through the use of scintillation crystals. These crystals convert the radiation being given off by the body into light. This light is converted into electrical impulses, which are interpreted by a computer program contained within the gamma camera. The resulting information is displayed as still images or functional animations of body parts and organs. Because it can show the actual function of organs, nuclear medicine provides more detailed information for certain conditions than is provided by other diagnostic imaging examinations, just CT scan or MRI.
All right, very good. Okay, so I want you guys to highlight the first sentence and highlight where it says the gamma camera is positioned above or below the scanning table and is able to detect the radiation being given off by the body part that has been targeted by the radiation. and then highlight the last sentence. All right. Nancy, can you go ahead and finish up those last two paragraphs, please?
The radioactive material used in nuclear medicine is known as the radiopharmaceutical. I think I said that right. Examples of commonly used radiopharmaceutical include technic.
Nancy, I did not do this on purpose, I swear.
Technetium, I don't know. Iodine and iodine-131 and thallium-201. Most radiopharmaceuticals are chemical bound to the complex known as a tracer. A tracer is designed to be attracted to specific areas of the body or in some cases no type of disease tissue. The most common nuclear medicine procedure include bone scans and nuclear cardiac stress tests, which are described in more detail in the next section. Other types of nuclear medicine procedures that may be performed include gallbladder procedures, thyroid studies, brain scans, lung scans, and liver procedures.
All right, very good. Natalie, can you read bone scans, please?
Bone scans are performed to detect small fractures, for example, stress fractures, or lesions that may not be visible on other diagnostic imaging examinations. When a bone scan is performed, the patient is injected with radiopharmaceutical. The patient must then wait at the facility for a predetermined period of time based on the area being examined. The purpose of the waiting period is to allow the radiopharmaceutical to be absorbed sufficiently so that an accurate diagnosis can be made. The gamma camera detects the radiation given off by the small fracture and it shows up as a hot spot on the nuclear images, figure 14.13. The radiologist reviews the nuclear images and prepares a bone scan report, which is sent to the patient's physician.
All right, very good, thank you. So really quickly, because this is so cool, like looking at this is so cool. Look at figure 14.13. This is a bone scan of the foot. Arrow shows the hot spot that indicate a stress fracture. So this patient not only has one, but two possible stress fractures. And I just don't know about y'all, but I think that is super cool. All right, nuclear cardiac stress test. Sabrina, can you read the first paragraph?
A nuclear cardiac stress test is a diagnostic procedure and used to elevate the cardiovascular health of individuals with known heart disease or individuals at high risk for developing heart disease, particularly coronary artery disease. Although a nuclear stress level test is more time-consuming and expensive to perform than a simple stress test, it provides more accuracy in diagnosing CAD.
All right, very good. So I just want you to highlight that first sentence on that paragraph. Talia, are you where you can read that next paragraph, dear?
Yes, ma'am. The radiopharmaceutical used for a nuclear stress test is usually the technetium 99 MTC, what's that, symptom, which is administered intravenously and targets the heart. Nuclear images included in the stress test are taken by the gamma camera during two phases, a resting phase and a stress phase, which is functional study. The resting phase is performed with the heart at a normal rate, whereas the stress phase is performed immediately after the patient exercises at his or her maximal target heart rate. The two sets of nuclear images, the resting images and the images taken under cardiac arrest, are then compared with each other. These images assist the radiologist in determining which parts of the heart are healthy and functioning normally. The images also identify areas of the heart that exhibit decreased blood flow during exercise, meaning that a portion of the heart muscle is not receiving enough oxygen. A decreased oxygen supply to a portion of the heart is known as cardiac ischemia and is typically due to the presence of the coronary artery disease. The radiologist reviews and interprets the images and prepares a nuclear cardiac stress test report, which is sent to the patient's physician.
Awesome. Very good. All right. Alicia, can you go ahead and read the next paragraph?
Positron emission tomography PET scan is a special type of nuclear imaging procedure. PET uses a special camera and computer to construct a 3D image of the area being scanned. This procedure is particularly useful in diagnosing conditions of the heart and brain, such as brain cancer and heart disease. Do you want me to read the guidelines or no? On the next page.
You can, but first, actually go ahead and highlight all of that last paragraph.
Okay.
So if you guys decide to work in, let's say, any type of oncology area, or maybe even like a general surgeon, your provider may go ahead and order a PET scan, because that's a commonly test that they'll do. All right, very good. Yeah, go ahead and finish her up.
Okay. Specific guidelines that may be required for nuclear medicine examinations are as follows. Number 1, depending on the type of nuclear medicine examination being performed, the patient may be required to be in a fasting state or to abstain from consuming certain foods and substances such as caffeine for a period of time. The medical assistant should check with the facility performing the examination so that the proper dietary instructions can be relayed to the patient. Number 2, nuclear medicine examinations are time consuming because most examinations require multiple scans. The interval between scans is determined by the part being examined and the type of equipment and radiopharmaceutical being used. There may be a delay between administration of the radiopharmaceutical and when the patient is actually placed on the scanning table. Follow-up images that may be done later the same day or in some cases the following morning also may be needed. Because of this, the medical assistant must inform the patient of the amount of time required for the examination so that the arrangements can be made with work and home schedules if needed. Number 3, because most nuclear medicine examinations require that the patient lies still on a table for a prolonged time, the patient should be advised to wear comfortable clothing to the examination. If a nuclear medicine examination requires exercise as a component of the test, the patient should be instructed to wear appropriate exercise clothing, including athletic shoes.
All right, very good. So you're only going to highlight the very first part on number 3 where it says because most nuclear medicine examinations require that the patient lie still on the table for a prolonged time. All right, so that finishes up chapter 14. Don't forget to send me chapter 13 study guide results if you've not already done so. I will let you ladies know when I get this uploaded to YouTube. That way y'all will have it. And then at 1 o'clock, we'll do our open floor discussion on anything that you might. Yeah, I think this is a really cool chapter for me. I enjoy this one. All right, Natalie, I got it. Thank you. All right, you ladies have a fantastic